If we've got students in training, then there'll be one other person.
Right.
If we've got a biopsy or anything like that in progress, we'll have a nurse inside here, and we will have a radiologist. Okay?
Yep.
So that's the reason when you're looking at your gowns, we can't have anything too fancy. We must be able to say, can I just have a look? And you don't want to start messing around with them at that stage, because then they start getting even a little bit more embarrassed. You know, they've got to stand up and you've got to undo the knot at the back of them, or you've got to do something. They're feeling uncomfortable with that. So I always just say, can I please just have a look? I just need to draw it, and we need to draw them on our pictures. Okay, she's got a big mole over here. She's got a big mole. I need to stick this little sticker on you because I need to show the doctor where it is. And where's the lump feeling underneath here? I need to put this little marker on you. Quite a personal thing, you know what I mean? Some people are okay with you touching their bodies. Other people really don't like it. And it's a really hands-on job. There's no way you can do it without touching the breast. You know? So you've got to actually bring the person over, and if they're feeling comfortable when they come into the room, you've half won the game. But if they come in still clutching everything tight, you know you're in for a tense few moments, you know. So I always try and find something to talk to them about, just to relax them, and, you know, just say, anything you want to know, just talk to me while we're doing it. The more relaxed you are, the easier it is for me to do it. Once I've got all their particulars and I know what I'm going to be doing, I say, I'm going to do the 4 images on you. We always do 4 images to start off with. We might need to do a few more. I go to my digital setup and I bring up their name, double check their dates of birth again so that I know that I've got the correct patient's particulars there. Because once we actually send imaging across to the other side, it's very difficult to correct if we've got something wrong on it. And then I walk them up here. So this would be almost as if we had a brick. This is, as we do testing every day to make sure that the digital machine is accurate. We test every day before we start patients. So this would actually represent a 4.5 centimeter breast. That is what you're working on. And it's just got special things inside that we need to be able to see clearly, little spots, little masses, and little fibers. And we check them very carefully to make sure that there's never any degrading of the image before we do that. Then you need to walk your patients forward. You need to, I always say to them at this point, would you mind if I just took your gown off completely, because I've got 4 images to do, and it makes it a lot easier for me if I don't have material in the way. And if they sort of like hold on and say, I'll say, that's fine, let's just do this side first. Yeah, let's just do it. Now, okay, so now we go to the next step. I need an arm, I need a sleeve that I can actually not dislocate their shoulder in. So it must be sort of like a raglan sleeve rather than an inset sleeve, because a raglan is going to actually allow you. Raglan is sort of where it's cut up, where it's not a tight fitting sleeve, it's sort of just got like a more open type of sleeve. You need something that's going to just bowel out. This is more or less a raglan. You know, it's like that. But you don't want it. You want it to there. Yes. So I want to be able to say to her, okay, let's just flip this side out, just pull your arm up gently, that's fine, we'll leave that side of yours. I'll just walk forward for me. Then I've got to say to her at the stage, now I've got to hold on to you, I can't do it any other way because I've got to be able to position you, you know. And I'll say, I'm just going to get you up as close as I can, then I'll bring the machine up. Okay, now I'm getting everything just to suit you. So at this stage, I've got to make sure that this material doesn't creep in here, okay? Because that material folded is going to give you artifacts on your mammography imaging, which is really sensitive imaging. You see everything.
Right.
You even see hair.
Really?
You've got to make sure that the hair is here.
Yeah.
You've got to make sure that the hair
not like an
is
X-ray,
behind. Not at all.
I'm feeling nervous to stand here.
Come on, you okay. So then I just say, I'm going to lean you forward, and now I'm going to bring this panel down. Now I don't want you to bend your knees at all. I want you to stand absolutely straight. Now I'm going to be holding on to you all the time. Don't pull away from me. So you're talking to the patient, you're holding them all the time. There's a lot of hands-on work, and you know.
The patients normally turn their heads this way.
I always say to them, for this one, you turn your face to that side, and when they've got the other one on, turn it to the side. So you can imagine we sort of face on, hands on, very close to that patient all the time, and then you bring down, I won't hurt you. There we go. You just keep squeezing. You say, just bear with me, okay? There you go. You've had your turn.
Okay, and so you don't need to put the arm up?
Yes, I do. I get them, I'll say, here's a handle over here,
Okay.
and there's another one over here, and then I've also got to sometimes pull their shoulders back, there's another handle over there.
Okay. Right.
There's another hand, you can just put your hand underneath.
Okay.
So, depending on what sort of shape, because the patients are all different shapes and sizes, you know, the old grannies are like this, necks attached to the shoulders, and you have to get to their breast. Do you know what I mean?
Yeah, right.
So there's various things that you try and do just to try and not flick their neck out of position or something. So they've actually designed this in a certain way so that people can't grip tightly. You can just hold it. It's not a very...
Yeah.
Because the last thing you want people to do is to grip tightly because it makes all their muscles tight. And when muscles are tight, you can't compress. It's not going to have blood done and really making it tight. They can't get that needle in. But as soon as that arm is relaxed and just clenched, you can get it in.
Right.
The same thing with mammography. The minute they tense, and they tense from the minute that they've changed. So the whole game is to get them as relaxed as possible. So we do one view of each breast like that. And then, so now I say, okay, now I'm going to do the other side, so on we go. As you can imagine, I strip as many patients down as I can, because it's a time-consuming
Strip
thing.
them all the way down, and start wheeling right at the beginning.
Just take the gown off when I'm ready to go, not when I'm doing questions or anything.
No.
When I'm ready to go, I'll just do it. And then we do this side the same way. And then what we do after that, you can step back again. We've done 2 views, and just don't get your head bumped. Okay? Then we turn the machine like that to the side, and we've got to lean them all the way in. So you're going to walk in there for me, you're going to lift up your arm, and you're going to lean right across the top there. And I've got to get all that muscle, and I've got to get all the breast on. I've got to keep my hands here to make sure I don't hurt his bones, and I've got to get it all the way down.
Right.
And there's certain things that we have to see in all imaging, and we have to be able to see nipples, we've got to see the bottom of the breast, we've got to see the whole pectoral muscle.
So there's no way that you could have any kind of string or nothing over there, right?
Got to get right up into that axilla.
What about this area? Can it be something here?
You can have it covered right from here.
So how low it should be?
Just
like
breast, just from here.
So
just from here
everything below, below breast can be covered.
From here down you can have material if you want to. Okay. But if you're going to have something solid for them to step into and have that solid all the time, you must remember old ladies, they've got to be able to climb into stuff, they've got to be able to do stuff up, so you're trying to eliminate that as much as you can. So those are the 4 basic views we do. Then if we see something that doesn't look as it should, we can take off and put another little paddle, a little baby one, squeeze that area out a little bit. But by this stage we normally just send it through to the radiologist and they have a look at it. Most everybody who's got a lump, absolutely everybody who has a lump goes through for an ultrasound. So because we've got so many people booked in a session, it's not like we're just waiting for the one person to finish here and take her through to ultrasound. We've got about 4 or 5 people waiting at the various stages of examination. I might do this patient and the doctor's busy doing an ultrasound on another patient, and then he might say on that ultrasound patient, I actually want an extra view over here, and he'll put a little mark, and I'll come and put a marker on. And then this lady will go and sit in the waiting room while the doctor's busy doing something else, and then we'll take this lady through for her ultrasound because now she's got a lump. So everybody who comes with a lump will have the whole process of having a mammogram and also going through for ultrasound. So I'll take you through. So now I'm finished. Now I'm going to take you through to ultrasound. Why do you take me through? I'll say, oh, why are you worried? What are you seeing on this film? Are you sure it's okay? Nervous people. They really are. So we'll just go through. You can come and have a look.